talk about children and antibiotics, something we can talk about this time of year because it seems they are getting them more. Doctors are being urged to use caution, however, when prescribing them. But when should you use them and when should you steer clear? Dr. Kharam Ghumman is a pediatrician, actually a family physician from Hartford Hospital. He's here this morning to talk more about it. Good morning to you and thanks for coming in.
Thanks for having me.
So we can talk about kids, we can also talk about the whole family. You know, I guess my first question would be, why is this a problem? Why are they being prescribed so much? Or is it just that parents are coming in saying, fix my kid, we've got soccer and hockey or whatever, and give them something that makes them better?
I think it's a combination of both. There is good data and studies to suggest mostly maybe nearly half of the parents, when they come into their primary care providers, they have a pre-visit expectation of getting an antibiotic prescription.
Ah, that's interesting.
And nearly a third of the physicians feel that way, that they're compelled to write a prescription. So it is a growing concern as we see nationally over 50 million prescriptions are written each year for antibiotics. And out of these 50 million, about 10 million prescriptions are related to upper respiratory tract infections.
Which is why we see them this time of year.
Exactly.
This is the time of year for that, yeah.
And a lot of those upper respiratory tract illnesses may not require antibiotic treatment in the first place.
So some, you know, issues obviously do require, and they're very effective when used properly. What are some things that parents should expect and really hope to get antibiotics for themselves or their kids?
So in terms of several reasons that they should be prescribed antibiotics, if the kids are young, less than 6 months of age, with severe symptoms, fever, not eating well, or 6 months over to like 35, 36 months of age, with positive signs on clinical examination, with positive history and, you know, severe symptoms over a short period of time, that are the things where we will want to prescribe antibiotics. Secondly, in older kids, 4 and above, if their symptoms were initially starting and within the 5-7 days period got worse again, or it has been more than 10 days and the symptoms are still not relieved, that's when they should consider antibiotic treatment.
So what if parents just say, well, so what? So what if I'm getting them all the time? You know, what's the big deal? But there's a pretty good reason. Yeah,
it's a multifactorial reason. All medications have side effects, and obviously antibiotics have side effects, and it leads to unwanted resistance. The same bacteria that cause these infections, and if we don't treat them judiciously with antibiotics, they can develop resistance. And at the end of the day, it's also the cost related to these treatments is also a concern.
So using them unnecessarily could mean they're not going to work when you really need them. All right, so a good conversation to have with your doctor. Thank you so much for coming in. We appreciate all that information.
Thank you so much.
All right.